It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area, Candace, that of course help change people's lives.
They certainly do. And our first best doctor, she's a bariatric surgeon. It's Dr. Preeti Malladi.
Before I met Dr. Malladi, I had gotten up to 447 pounds. Normal things that normal people can do that are in shape, I had a hard time tying my shoes. You think that's no big deal? It was hard for me to tie my shoes. You wouldn't believe this, but I used to be a Marine. And so I was always in shape, thinking everything was in shape. And just over the period of years, man, I lost it. I was an excellent basketball player. It got to the point where I couldn't play basketball no more. I stopped playing softball. All of that ceased. I lost out on just doing things with my kids, and that hurt. I came to a point in my life where I realized, man, I couldn't do this no more. And so it's just a lot of, embarrassment.
Roy is a great patient of mine that came to me after struggling with his weight for years and years. He had developed multiple medical problems, including diabetes, high blood pressure, and sleep apnea. And he actually told me that he had really lost hope in his ability to overcome this problem. And we discussed how bariatric surgery can really help him achieve his goals of weight loss, but also to be able to get rid of these other medical conditions. Well, what's interesting with obesity is that adipose tissue is also a hormonal organ, and it actually can affect other medical conditions and cause people who have predisposition to diabetes to get type 2 diabetes or have other medical issues. The fat actually can infiltrate certain organs and cause problems. And so when you perform weight loss surgery, you can actually not only lose the fat, but you're really affecting these medical conditions at their source. And so this is something I want people to be aware of, that helping resolve your obesity can resolve these other medical conditions.
I wish I had did the surgery years ago. I went from 447 pounds to now, I weighed in last week, I was 316. I went from a size 66 waist to now size 50. I'm no longer on my diabetes medicine, and now I feel rejuvenated again and coming back. It makes a big difference, man. And I just want to encourage anybody that's thinking about it, you need to do it. You need to do it.
Brushing your teeth can prevent stroke. People suffering from gum disease are twice as likely to have a heart attack or stroke.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off, and I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
Let's talk about pink eye. Pink eye is an infection of the lining of the eye. It's called conjunctivitis in medical terms. And it can be caused from bacteria, in which case you need certain types of drops for your eye. And it can be caused by viruses, and that's the more common cause. Now, you can tell if it's a virus in that the lymph node right here in front of your ear will be swollen and tender. That's because it drains the eye. Now, if that lymph node is tender and swollen, that's usually a virus. So you don't need antibiotics, you don't need antibiotic eye drops, but you are contagious. Now, if you have thick, creamy, ugly pus that comes from your eyes, you know, they're stuck together in the morning. That happened to me a lot when I was a kid. That's usually a bacteria. That little lymph node won't be swollen. You will need antibiotic eye drops, and it'll probably be contagious. Now, how long is it contagious? Well, a virus can be contagious for weeks and weeks. Bacteria is usually just a few days. Generally, once the redness starts to go away, about 12 hours later, you're no longer contagious.
Hi, I'm Dr. Rimlawi. Are you experiencing arm or leg pain, numbness, or weakness? Do you know this could be coming from your neck or your back? To find out more if minimally invasive spine surgery is right for you, check out my videos on bestdocsnetwork.com.
I was having problems with incontinence, needless to say, and that's something women don't like to talk about. So it's one of those things you just really sort of keep to yourself, where you don't even talk to your best friend about it. This was something that, you know, had been bothering me for a long time.
Genityte is a treatment for stress urinary incontinence, urgency incontinence, urinary urgency frequency issues, as well as rectal incontinence and rectal tone issues.
As a healthcare professional myself, I was actually researching procedures that were non-surgical that could maybe help alleviate some of the urinary symptoms. And then that's when I found out about Genityte and Dr. Carol Norton at Finer Touch.
You get to know where every restroom is in town, needless to say. But it's just, so this was something that, you know, it takes control of your life. And to finally be able to say, I've got the freedom to, you know, live like a normal woman should, you know, without having to always plan for it.
The treatment is done in the office. It takes about an hour to do the procedure, and there are generally 2 to 4 treatments required. The number of treatments really just depends on whether or not we've reached the end point, which is resolution of symptoms, and you can actually see the tissue tightening. So we're looking for that tightening effect to hold between treatments.
You can't go to just any doctor and have this done. So Dr. Norton is just, you know, right on top of the newest technology. And she's one of only like 4 doctors here in the US that have been totally trained on this. So she, you know, was so excited to hear about it.
Basically incorporates the use of an infrared technology to help tighten the tissue of the vulva and vaginal area in a way that's very natural to it.
Now I'm probably 80 to 85% of my symptoms are improved, and for me, that is wonderful.
I would say to any woman, if this is a problem that you're having, come talk to Dr. Norton in the Finer Touch, because you do have hope out there.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bid on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
As always, for more information, to see great videos, or to even request an appointment from one of our doctors, check out our website. It's bestdocsnetwork.com.
That is the place to go, and Candace, right now, the place to go. Let's move on to our next best doctor, one of the best plastic surgeons in the entire Dallas-Fort Worth area. It is Dr. Robert Wilcox.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The aspirin after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because it's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it, so that the antibiotics can't eradicate it. What the aspirin after surgery treatment does is an ultrasound device specially designed for the breast that imparts energy in to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
When patients come to see me, they're usually at a point where the pain is starting to affect their daily life, whether it be at work, their personal life, their moods, anything of that nature. They notice that the normal things that they used to do aren't really helping anymore, such as taking medicines that they get over the counter or going to see a massage therapist, chiropractor, acupuncture. All those things seem to be failing, even if they have worked in the past. So at that point, the patients are at a point where they feel that there's something else going on and they need to be evaluated to figure out what is wrong with their low back or neck. When a patient comes in my clinic, first what I like to do is sit down with the patient and learn about what's been going on with them. That's, do an extensive history, spend the time with the patient to find out why they're hurting, where they're hurting, how long they've been hurting. And that's in addition to a physical exam to see if I can't evaluate the nature of the pain that the patient's having. When patients come to my clinic, this is a perfect example of what a patient might be experiencing that could be causing their low back pain or leg pain, or even their neck pain and arm pain. This is a herniated disc, or an example of a herniated disc where the nucleus pulposus, or the center of the disc material, has actually excreted through this annulus fibrosis. When this happens, this can cause spinal stenosis. It can actually impinge upon nerves in the spinal canal itself, or if you can imagine a nerve root coming across this, coming out, exiting to your leg or your arm, and it actually getting pinched off by this herniated or bulging disc. What the Acuroscope procedure does is it addresses a condition like this. The laser energy is focused right here on the actual bulging or herniated disc, where it can reduce the herniation and improve circulation to the nerve and reduce impingement on the nerve, and patients can have immediate improvement of their symptoms and pain.
Is your energy lacking? Though it may be the last thing you feel like doing when you're tired, exercise. Even a brisk walk can be more effective than a nap or a cup of coffee at fighting fatigue.
I was very apprehensive about coming into preferred imaging. The night before, I had read every negative thing that could happen when you have an MRI. So when I came in the door, the secretary met me, just smiled. And the technician for the MRI was just really helpful, very reassuring. I was so happy I'd come to preferred imaging.
So I had saw a physician out of town, and he had looked at both MRIs and was wanting to order a different MRI. And he preferred the one for preferred imaging better than the other one, and asked me would I return here for the one he was ordering. So we did, and he was very pleased with the second one that I had here as well.
And the setting, the waiting room, and the changing room all were really nice.
Their room is really painted pretty neat. It's very artistic, and just kind of makes you feel like you're not in that normal cold hospital type feeling, just more of a warm type feeling.
The staff was uplifting and answered all my questions, and the procedure was so stress-free. The technician gave me a button to push if I needed help instead of wiggling my feet and trusting that somebody was going to see me. The first thing I did when I was inside the MRI machine was to test the button, and she immediately came and pulled me out and said, "What do you need? Is everything okay?" And I was like, "No, I'm just testing the button." And she was like, "Oh, that's okay. I just want you to know that I'm here and I'm watching you and you have the button." And so that was very reassuring. And then the procedure was just like they said. I had an absolutely fabulous experience at Preferred Imaging.
I also live 2 hours away, but I am in a small town and the imaging there is mobile and it's not very well. So I do travel up 2 hours so that I can get good quality imaging. And so when the doctors like it and prefer it, it's worth the drive of 2 hours.
They're really friendly, really nice, very helpful. It was I really did have a good experience here.
Don't forget, for more information about any of our great doctors, as well as hundreds of outstanding videos, head to the website, bestdocsnetwork.com. Right now, it's time to head to our next best doctor. It is spine surgeon, Dr. Michael Rimlawi.
I had been living with neck pain for about 15 years. It took a few of those years to figure out that it was really my neck. It was horrible, lots of neck pain, terrible headaches, nerve pain down my arm. My middle fingers in both hands would go totally numb. Makes it very difficult to work when your fingers are numb if you're working on computers. I had had a bulging disc in my neck. It started out to be just one bulging disc, but by the time we found Dr. Rimlawi and got in to see him, I actually had 3 bulging discs.
We looked at her neck and I said, unfortunately, it was a big portion of her neck. It wasn't just one level. A lot of times people come in, they have 1 or 2 levels. And poor Tara, she had about 75% of her neck that was involved, that had some type of problem in it. She kind of felt that she wasn't fixable. She wasn't able to do the activities that she normally liked.
I couldn't do important things anymore, like my husband and I couldn't go dancing. I couldn't go on walks with my son. We couldn't go play at the park, to the point of not even being able to lift a gallon of milk out of the fridge. The quality of life had diminished greatly, and it was very depressing.
This type of surgery she had, normally it would have a big incision really from here all the way down. A lot of muscle cutting, a lot of bleeding. So there's a little trick where you can go in between this muscle and this muscle, right between them right here, and you can get away with really not cutting or hardly cutting any muscle at all. Cosmetically, it's better for the patient. Pain-wise, it's better for the patient. Recovery-wise, it's better for the patient.
The relief that I've gotten from Dr. Rimlawi and the minimally invasive procedures is such a godsend. It has been such a blessing in my life and has given me the quality of life back.
She's like a whole different person now. That's the best part about this. You see a patient, it's amazing how much neck pain or back pain can change their life and make them into somebody they're not. And then now I see her and she's so happy. That for me is the ultimate gift.
Don't skip breakfast. Fiber in the morning means less hunger late in the afternoon, when you most likely feel tired and gorge yourself on sugar. An early start on eating also keeps your metabolism more active throughout the day. Breakfast eaters are thinner than people who just rush out the door.
Diabetes is a systemic disease that affects multiple organ systems, and in particular, it affects the feet. The main complication that occurs with diabetes is something called neuropathy, which is where the patient loses the sensation in their feet. Once that occurs, they are at risk for pressure calluses, ulcerations, infection, and possible amputation.
At the end of November, I developed a blister on the bottom of my foot that then turned into a diabetic ulcer, which then caused an infection in my bone, primarily my big toe, and had to have my big toe extracted.
A lot of people don't realize that there are over 75,000 diabetic foot amputations a year. Of those diabetic patients that have amputations, 68% have a 5-year mortality rate.
Pauline came in, and because the diabetes was so out of control, her ability to heal these pressure ulcers on her feet were severely limited, and that's one of the main problems with being diabetic is your ability to heal common ulcers or pressure areas.
I didn't realize how bad it was, and it can just come on you, and if you don't get it taken care of, then it will lead to not just toes, but your feet and your ankles and your legs.
Another thing that diabetics are prone to is peripheral artery disease. This is poor circulation in the extremities. We have modalities here in the office that we can help assess for these risk factors. For example, we have a peripheral artery test that puts blood pressure cuffs around your arms and legs, and what it does is assess the amount of blood flow that's getting to your extremities. By this, we can help determine whether there is further intervention that's needed. So if you do end up having a sore on your foot, we can address it and it will heal properly.
We are now seeing Pauline much more frequently for regular checkups and providing special shoes and inserts as well to prevent further pressure areas from developing.
I'm feeling stronger, and finally I'm getting to the point where it really is important to take care of it.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Before I went to see Dr. Swanson, I had just had a baby. I was 26 and found out that I had gout. Woke up one day and couldn't walk. My feet hurt horribly, and went to my doctor, and she ran some tests, and it came back that that's what the problem was. And she told me that basically the easiest way to get rid of it was to lose weight.
Megan Zarella, she's a relatively young girl who significantly overweight. She was in her 20s, and she didn't have diabetes or high blood pressure, but she knew that she was in trouble because of her weight. She did have gout, and that causes joint pains and flares up when you eat certain things. And we know that, that doing weight loss surgery can help that. So she was real interested in not only being able to be more physically active, but also in helping out with those joint problems that she had.
Well, I was 250 pounds, so when I went to see Dr. Swanson, he said that I was actually a really good candidate for the weight loss surgery, and we talked about which procedure I'd want and discussed what insurance would cover, and decided that the gastric bypass procedure was the best thing for me to do.
So she had a gastric bypass, and she's just done really well with that. She's still relatively early in the game and is continuing to lose weight, but she's done very well.
Since the surgery, especially now that I've lost so much weight, energy levels are through the roof. As far as my gout goes, I have been symptom-free since surgery. I haven't had any issues at all. I came off all the medications I was taking. The overall experience with this has been very positive. It's not easy. It takes a huge commitment to stick to it. When I see the results I have, I wouldn't change it. I wouldn't go back and do anything different than I have.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And the good news is, Candace, for more information about any of these outstanding doctors, head to the website, bestdocsnetwork.com.
And if you have a question or a comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
Don't forget, the Best Docs magazine is out. Check your local newsstands. We'll see you next week.